October 23, 2020. Okay, today I would like to thank to Hsinchu Science Park and the initiative InnoMed project conducted by ANIASPS 10 Live. Together with Tiger Accelerator and TGN, we organized today P4E expansion. P4E expansion is a joint initiative by Business Angel Europe and Tiger Accelerator and TGN. Our purpose is not just to match with investments, but also the resources the startup need for their internationalization action to de-risk their risk. So that means in Business Angel Europe, they are the business angel clubs of European business angel. They also have a country clubs, and this initiative is the business angel normally are the specialists of certain sectors or industries. So they are not only interested in investing the money as a financial investor, they actually like to be the strategy alliance or the strategic investors. But today, Yella from the Wider will also talk about the soft lending package. I think the soft lending package is also very interesting for the expansion of startup from Taiwan to Europe and the Netherlands, Europe to Taiwan, vice versa. So today, our P4E expansion, our price will be the matchmaking with the investor with the soft lending packages, but also have the hours, consulting hours, okay? And we would like to thank to our advisor from Hsinchu Science Park Investment Division. You can see in the slides. And we also like to thank to the sponsor from various organizations, including EBU in Utrecht and several organizations. And now I would like to give the floor to Michael Lin of InnoMed Project. Michael.
Yeah. Okay. Good morning, Valerie and other guests from Netherlands. I'm Michael. I'm from AAN. AAN is an organization that we promote the global accelerator around Asia to collaborate with each other. So I would like to take just 1 or 2 minutes to introduce the InnoMed program. And then we have 4 startup companies that will pitch their product and services for you. And InnoMed is a program that's sponsored by the Hsinchu Science Park Bureau. And Hsinchu Science Park Bureau, maybe you know that the management organization of Hsinchu Science Park. And Hsinchu Science Park is the largest high-tech park in Taiwan, and we assisted the bureau to promote the startup company. So in our program, we have mentorship, we have matchmaking activities, and also we have demo day. And most important, that we will introduce Taiwanese startup company to go global. So for last year, we have our program. We bring our startup company to Japan for the expansion. And today we have a very good opportunity, especially thanks for Valerie. And we have this kind of the stage to promote our startup company to Netherlands. So I think that the 4 startup companies that have their strategy, they have an idea to go into the Europe market, and they may need your help to facilitate their expansion. So InnoMed, this year we have mentorship, so we invite several experts to coach our startup company. And the matchmaking activity is a very good opportunity for them to match the industry. So we have period activities for the startup company, and this program that began last year. So this year, unfortunately, we the COVID-19, so we can go nowhere. So, but we we very happy to have the chance to connect with you. So I think that's a very short and the more important that the Xinjiang Science Park is a very innovative area. So this year, for the last few years, that we start to promote the startup company in Xinjiang Science Park. In Xinjiang Science Park, we have space. We have this accelerator program, and we hope that if any Netherlands startup company they want to go to Taiwan, we have some learning program for them. We help them to connect the local industry, high-tech company, and some manufacturing capability in Taiwan. You know that we have a very good capability in manufacturing side. So we will collaborate with Barry, and we will help the Netherlands startup company when they come to Taiwan. We can do this kind of assistance. So I hope that today's event will be very successful, and hope every startup company can get your support on your side. Thank you very much.
Thank you for Michael's explanation. And yes, this year, due to COVID-19, a lot of delegation and initiative couldn't go on, but thanks to the digitalization, we could meet. And I think the Taiwanese audience, you should know you are very lucky. You still can gather physically, and you can travel or do the sightseeing in Taiwan Island very freely. Here, we actually are in a lockdown situation, so we are all stay home. One of our speaker, Yella, are you online? Because Yella just tell me he has a problem with his Wi-Fi, and that's another problem. Taiwanese audience should feel very lucky. We have very good Wi-Fi system. But anyway, if Yella is not online, I would like to take his. I would like to help him to present what he wants to present. First,
I'm here.
Is Yella online? Is Yella online?
Yeah, we can see him.
Yes. You see Yella?
Yes, we can see each other.
I couldn't see you. Okay, so if you like, you can share your slides and you present. Thank you to be here.
Okay. Yeah, sorry for the inconvenience.
Yeah, you first need to look at their site. You know, there's a place, Frank and Taiwan delegation visit the garage cafe, and we forgot to pay the drink. There's a place.
I was not there.
And you must go there. Their cake is very delicious. Okay, I give you the floor.
I will share my presentation now. Eh?
Okay.
Can you see the full slide?
Very well.
Yes, no problem.
So, good afternoon. I'm very happy to see you and to meet you all in Taiwan. You are a very lucky nation with the COVID-19. As Valerie already explained, we have now the second lockdown here in the Netherlands, but also other countries in Europe. So this is the first time I'm talking about COVID and the last time I'm going to talk about COVID, because we have to think also beyond the present pandemic. But we are very jealous about the situation that you can freely walk around and do everything you want in Taiwan, and we still have to wear masks and stay at home as much as possible. So my name is Jelle van der Weijden. I'm a Director of Health in the Regional Development Organization in Utrecht. I hope you can hear me well.
Very well.
Okay. I'm also working for the Economic Board of Utrecht, and we have a regional marketing branding name called Utrecht Region, which is the 26 cities of the province of Utrecht. but also the knowledge institutes, like we are going to talk about that in Utrecht Science Parks, but also about all kinds of organizations in healthcare and in other areas where we have connections with the public-private partnerships. Utrecht region stands for the most innovative region of Europe. We have 3 years at a row, we have won this prize because we have a large innovative ecosystem in Utrecht. We are also having the largest science park of the Netherlands. We have 5 science parks, but we are the largest. And the aim of the Utrecht region is to become the healthiest region of Europe. That means that we have to do a lot of things in terms of prevention, digitalization, but also in understanding diseases and to overcome all kinds of diseases. So if you have questions, please connect directly. What I particularly like is yours. Can you see my second slide?
Not yet.
No.
Okay, then it doesn't work again. Okay, then we do it like this. Now you can see the second one, isn't it? You can see the second one now?
You can see now.
Yes.
Yeah.
See now.
When you look up in the Hsinchu Science Park, you come to this picture. I really like it. This is telling something that you're proud of what you're doing and how you enjoy working there, but enjoy getting knowledge and getting to know each other, but also to really look forward to the future. I really like this. Thank you very much for showing this to the world. Utrecht Science Park is, as you can see, a very green area. And we are focusing especially on the science park on improving quality of life, improving health. So that is the focus of our science park. We do a lot of things more, but that is the focus. We do research, we do education, but also we have a large hospital called the UMC, University Medical Center Utrecht. We have the Wilhelmina Kinder Hospital, Child Hospital, and we have the Princess Maxima Cancer Care Hospital. So we have 3 hospitals on the Utrecht Science Park working together with the clinicians, working together with the research. We also have a large portion of entrepreneurship. Now we'll come to that later. Utrecht University is a very old university, established in 1636. We have more than 550 professors, 12 Nobel Prize winners, and the Shanghai ranking list says that we are the #1 of the Netherlands universities. Not only we have research on our own and clinicians working in hospitals on our own, but we also host the National Institute for Public Health. So we see that a lot of research, but also extension to research in public areas is coming to this in public health and environment. And especially at this Corona time, we see that this is a very important combination. And we also have this the medicines evaluation board, also on the Utrecht Science Park. So whenever you have an evaluation of your drugs, it comes to the board to get into the market. We have a lot of startups in the Utrecht Science Park, but one of the Utrecht Science Park is focusing on biotech, was founded in Utrecht and is now one of the largest biotech companies in Europe. It's Genmab. And if you look at their website, what they are doing is very interesting, also for the Hsinchu Science Park researchers, I think. So Genmab is now becoming one of the icons of our Utrecht Science Park. We also have an extension of focusing more on development and manufacturing. And there is a large company, an Indian company, building a facility for vaccines, vaccine production. So manufacturing and development in the Beeldhoven Science Park. We are very close connected to the Netherlands ecosystem called Life Sciences and Health. And the Netherlands Life Sciences and Health top sector is focusing on 4 missions. And I think that's very important also for the Hsinchu Science Park research to see whether they can invest, co-research, but also think about what is going on right now to connect this to the 4 missions. One of the missions is lifestyle and living environment. Second is care in the right place. Third one is people with chronic diseases. And the fourth one is the people with dementia. Those are the 4 central missions of top the life sciences and health connected to the different science parks in the Netherlands. And we want to add 5 more healthy living years for everyone. Even if you have a bad, if you have a low income, still we want to start with 5 more healthy. We cannot do this on our own, so we do a lot of coordination together with public-private partnerships, and 4 of them I would like to emphasize. One is the Oncode Institute, which is an organization, a European organization hosted in Utrecht, and it's really deep diving into the data of cancer, how we can impact life to understand cancer and to really cure cancer. That is the objective of this Oncode research organization. RegMed XP, regenerative medicine, focusing on repairing disease, understanding really how people get a disease and trying to repair it on a DNA level. Regenerative medicine is one of the topics, I think, in the whole world that can cure really diseases. Organ on a chip, consortium on a vision. So we are focusing on human organ and disease modeling technologies. Issue to see how we can really align with early diagnostics and monitoring solutions. The fourth one is cardiovascular alliance, where we try to really lower the cardiovascular diseases, because we see that also in the Netherlands we see a lot of people with obesity and overweight and high blood pressure combination gives you a cardiovascular disease in time. So how we can reduce that? That is a really big issue in the Netherlands. It comes together in this picture, and in the middle you see healthy urban living. How can we live longer, healthy in a city environment? And on the left side you will see sustainability, water, climate, decarbonization, future food, future cities. Those are the items that we are focusing on Utrecht Science Park in terms of the sustainability. And on the right side you will see One Health, which is a combination of human health and veterinary health, animals. The second one is personalized medicine and health, science for life, regenerative medicine, and healthcare innovation. You see this combination of items in life sciences and sustainability is absolutely a focus in Taiwan. But I see that we are focusing on smart cities, but not only on smart cities as such, but also on focusing on health in cities. And I know most of the people in Taiwan live in cities. So this combination of this overview of research can be very important to cooperate with the Hsinchu Science Park researchers and say, can we leverage One Health is this reducing the burden of diseases. Now, one of you, we have seen the COVID, but also we know a lot of other zoonoses where people come in contact with animals, like in farms, like in the nature, but also in your home environment, where zoonoses are diseases that come from the human to the animals and the other way around, and how to understand how to overcome this. This is the One Health proposition that we are focusing on. If we want to really go to personalized medicine, we have to understand what is going on your level of DNA. And maybe we can take a little bit of your DNA and put some into an environment on a chip or in a lab environment and build an organoid on it. And your organoid can be then be tested with your personal diagnosis, with your personal treatment. And then if that works, then you will go to the real body of a person. So organoid is one of the main topics we are focusing on regenerative medicine. We are working also with organizations like Siemens and Philips Healthcare to really build the highest level of image-guided interventions, to really build machines, MRI scans, but also all kind of software solutions to really go to the point where the tumor is, and to make it really clear how great and how it forms and how we can interact with it. The Princess Maxima, as I told you, is one of the hospitals. This is the pediatric oncology center in the EU, so it's the largest one. And it's a very important part of the research going on cancer. Regenerative medicine, I already said that a moment ago. But what I also want to emphasize is that we're not only looking at research, but also to businesses. So how can startups from Hsinchu Science Park can come into our soft landing programs, can be supported by seed funding, by startup support, by scale-up support, and even go to mature level, as GenMap has shown that we can do. So we have all kinds of possibilities for our science, but also for our startups to grow and become a really big player in the market in Europe. This business development comprises of different areas, knowledge, of course, but also partnerships. We have a large networks in Utrecht to connect to, and we are a very open and a very innovative region. So come and see and work together with us. One of the organizations that I want to emphasize in this scale-up phase or this incubator phase is Utrecht Inc., which is an organization that is a top-level incubator where you can start your business in Europe, and they will help you with a program to really to become a good player in the healthcare market, and they have a community already with really successful startups. So what are we doing right now already? On the first level, we have been working already in 2 years, and one of the pitches, two actually, of the pitches are coming from this Rapid Health coordination program already. We have 20 alumni in 2 years coming from Taiwan through a combination with MOS, NALABs, to the Utrecht Science Park, to the Utrecht ecosystem. That is one program that we run twice a year. The second program that we just started is the hub-to-hub connection with TACC Plus, with Startup Terrace and Tiger Accelerator. And we are going to see how this can flourish also in the combination, not only from Taiwan to the Netherlands, but also the other way around. So we're really looking forward to bring this hub-to-hub connection to a higher level. And the third one is just this month signed. We are going to work together with Taipei in a startup program, exchange program, in the global startup program talent from Taipei, but also on other sides, we have this Utrecht Region Health Accelerator program. So we are looking forward to work together with Hsinchu Science Park on these programs, and we are welcoming you in Utrecht region, and we hope that we can find a lot of companies that are interested in to come the other way around to Utrecht, from Utrecht to the Hsinchu Science Park and say, come play, grow together. Thank you very much.
Thank you, Jelle, for your comprehensive introduction. Also, to reflect the purpose of Pitching for Expansion is not just to match the funding, but also the soft landing packages and the networking partners, strategic alliance. Thank you for that. And let me introduce. Can you see my slides?
Yes.
Okay, I just copied this slide from Yellow. Okay, I hope Hsinchu Science Park, InnoMed, AAN, Michael Lin, your initiative can be on this map, because I know you also focus on health and med tech, right? So I think we can expand more hub to hub connection, and you also try to connect to more other hubs in Netherlands, right? So in Taiwan, we will also connect to the other hubs, and we hope Taiwan can be the gateway for the Dutch European company to go to Asian markets, and vice versa. Utrecht and Netherlands want to be your gateway for the Taiwanese or Asian company to go to this way. Okay, and now we will continue. Our next program is a pitching for expansion. We have 4 Taiwanese scale-ups and 1 Dutch, but the group were increasing because today is Friday, so some Dutch people are not available, okay? But this initiative, we will continue organize more pitching event more often. And I would like to quote Golden Chen, a golden 4 minutes pitching rule for all the pitcher today. Golden Chen is the chairman, the first chairman of the Innovation Committee of Taiwan Business Association in Netherlands. They represent all the Taiwanese investors in Netherlands. And Golden Chen is the VP of Mega Bank International Amsterdam, and he has 7 years experience in Silicon Valley and several countries. So Golden Chen is one of our business angel, okay? And he always remind the pitcher to follow this 4 rules, okay? First, you have to introduce yourself and describe your unmet needs and your solution. And secondly, you have to describe your competitive advantages, and then your milestone, and then why you need money. But today, you don't only say what the money or how much money you need. You can also say what kind of resources, okay? And I would like to introduce our today jury. Today is the first jury is a Yella from the Vida. He will look into your needs of matching to the necessary networking partner, or maybe the local fund or subsidy possibility. And second jury is Jasmine Zhou. She lived in Silicon Valley more than 20 years. She helped many companies to go to IPO and to be M&A. So she is our advisor for Rapid Innovation Holding in Utrecht. And our third jury is Yizhen Li. She has been the VC, especially in the life science sector, for more than 20 years, and she is currently our advisor for Tiger Growth Fund. Okay, and today we have a 5 pitch. The first pitch is from Taiwan, Singular Wins. The second, Atrov Biomed. Third is Honeywell Technology. 4 is iNavy Biomedical. The Dutch is Swanbong Illustrating. So I would like to give the floor to the first pitcher, Singular Win. Good luck.
Hi, everybody, especially my old friends in Utrecht. I'm so happy to see you guys, and it's my great pleasure to be here again. My name is David. I'm the CEO of Singular Wins Medical and also the founder. We believe that everyone in the world deserves a healthier life with a much affordable cost. I hope this is the right time to talk about the post-COVID era. However, we know that maybe the second wave of the pandemic is coming again. So let me wish everybody stay healthy and safe. Thanks to
David, I don't see your slides.
Yeah.
Hi, David. I don't see your slides.
No? Okay. I don't know what happened.
Sophie, could you please play slides on the other computer? Thank you.
During taking this free time, let me say hello to Yella.
Can you see the
slides?
slides?
Good. Slides, good.
Okay.
Okay, let me restart it again from the second page. The page ahead. Okay, this one. Thanks to the improvement of technology and also the connected devices and high-speed network, through the help of the algorithm and AI, we can develop a brand new business model rather than the hardware itself. Because this is the business model innovation we are trying to achieve. Rather than information technology, we are now trying to deliver operational technology, which means more perspective on the business model. I will explain more later. The first disease we try to address is sudden cardiac arrest. This is so-called, well known as a silent killer, means you don't know when, you don't know who, and you don't know where it may happen. It is not necessary to be old people or fat guys. It can happen to anyone. So this is the challenge, to know better in advance when it happens. So taking a quick glance of the market, this is a huge number. Just taking the American market, for example, is over $34 billion a year. And the solution provided by SimilarWinds Medical is a solution, is a platform, starting from our own hardware and our own algorithm. And the solution can, let's see the example. From the left-hand side, you can see there are 3 different applications addressing different needs, medical needs. And from the right-hand side, it allows the doctors, for example, in the UMC Utrecht, they can pick one of their patients around the world and see their very critical vital signs, simultaneously their EKG, their respiration, and their skin temperature. And from the left-hand upper corner, you see we can also monitor simultaneously their fever and respiration. This can be well utilized as an early sign of the lung infection. So currently, we are now talking to the government from Indonesia. They are testing our solution in the border control in the airport. So here I try to address our innovation model, because we try to use a very simple, very reliable hardware. This is the semiconductor part, but we fix different problems by delivering different solutions. And the solutions are with the cooperation with the doctors in the hospital. So the innovation model is very different than the traditional Taiwanese manufacturing business model. We use one single hardware, but we can fix different problems. And in words, it is everything to do with EKG, with vital signs. So we collect vital signs, and the link in between from the hardware and the symptoms is AI and big data. The next disease we are now working with TMU. This is Taipei Medical University. We are now running a clinical trial there. It's OSA. It's also a very big market. As you can see, this is a huge population, and also a big market, over 11 billion US dollars in the States. And long-term lacking of oxygen can lead directly to many kinds of chronic diseases. So we put OSA diagnosis at home instead of doing the PSG test in the hospital. And this is OSA diagnosis I personally did in the hospital. We turned this PSG test from that to this, to one adhesive patch, and make everything simple and low cost. Why we can do that? Technically, as you can see, this some comparisons. We collect data, and the data obtained from the PSG in the hospital, they are perfectly compatible. So with this data and also the big data analysis, the doctors in the hospital can judge, can diagnose if the patient have OSA. Some tractions, as I can say, as I have said before, we have one very big customer, which is the Indonesian government and also the telecom in Indonesia. And also we got 2 hospitals in Europe. One is in Spain and another one is in Italy. They are now testing our solution in pandemic control. The number 3 clinical trial we are now working with a hospital in Taiwan is is for the hemodialysis risk management. As we know that there can be many risks during the process. And after this clinical trial, we can deliver a tool to mitigate all kinds of risks. Thank you. This will be my last page. Thank you. Thank you, Yella.
Thank you. Now we go to the second picture, Accelerator Biomed.
So there is no Q&A?
Oh yeah, sorry, that's my mistake. you speak your pitch so well. Please you remember if you have any question, please ask.
David, thank you very much for your comprehensive presentation. You are shorter than I have ever seen before.
I'm so happy you look the same as last year.
Well, I have my hair very short now. Yeah, David,
Yes.
you're focusing on different areas where you have your platform, which is
Yes.
the basic, but you continuously point out that your platform can be connected to different diseases. I really like this idea because then you can leverage one technology in different areas.
This is a very important question because this is very helpful. It's giving me a chance to explain more into detail. Because you see, the very important advantage of this model is we can use one hardware. And if this hardware is approved or cleaned by FDA, then the safety is somehow guaranteed. And we address different diseases. We deliver different solutions by big data analysis and also AI algorithm. That means we can use a very relatively reliable hardware, but we can go to different application field. And this is our unique business model. Of course, this model we will need a lot of data input, but this is what we are doing with the hospital doctors.
Yeah. That was one of my two other questions. One of the questions is, of course, if you want to go to Europe with these kind of solutions, you really have to look at the GDPR, the privacy regulation.
Yes, privacy. Yes, yes.
You have enough built already these privacy rules inside.
We know GDPR, and we also know the regulation in the States, and it's crucial for especially to the business model like what we are doing. So we will put 100% attention to the compliance to GDPR. And also we are now raising fund for the CE mark application, and on the way to get the CE mark, we will also invest in the privacy protection because it takes a lot of capital to comply.
I understand that. Yeah, thank you very much. The other thing is the OSAS, the obstructive sleep disorders, and those kind of. I really like this idea as well, but this is a very overcrowded market. There's a lot of diagnostics tools already in place.
There can be different the diagnosis tools, but the gold standard is PSD in the hospital, in the sleep lab. If you have nearly 100 wires connected to your body. But the technique we are using is medically proven. It's called cardiopulmonary coupling technology. It takes only much fewer data input. One is the EKG, another one is the breathing, the signal from your respiration. And we also add one more, which is the posture. So the doctor can calculate through these three channels, independent channels. Then the outcome will be the RDI, Respirational Disorder Index. According to that index, the doctor can somehow judge if this person needs to have further medication. And this can be drastically reduce the complexity, and people don't need to go to the sleep.
But you see, today is a picture for expansion, so maybe we can have some offline follow-up, okay? Thank you, David.
Sure.
Thank
you.
Yeah,
Thank you,
nice to see you.
Yeah.
Let's go to move to the next pitch. Accelerator Biomed.
Hello, good morning, everyone. My name is JT Molly, and we are Accelerator Biomed. I'm the founder and also the CEO of Accelerator Biomed. And first, I'd love to introduce our team members.
The slide, please. Slide, please.
Slide? Okay.
Slide from Sophia.
Okay. Can you see the slide now?
May continue speaking. She's busy with slides. Yeah.
Okay. Accelerator Biomed is composed of a group of preventive medical professional R&D, doctors, professors, and researchers from National Taiwan University. And we are committed to provide the non-invasive, no-drug, and effective biomedical healing technology for all patients to improve the quality of life. And namely, wash away all the pain. And it is also our corporate philosophy. And I'm Jackie Molly, and also the co-founder of Accelerator Biomed. And I devoted into the epidemiology and preventive medicine. I've been working in hospital labs and academic fields. With our unique R&D technology, we are devoted to help more people through our patented skills and products. And secondly, you can see that we focus on these three main markets, and especially the elderly, the long-term care, also the beauty industry. And these two is our focus. And
sorry, excuse me. We didn't see the slide yet. Could you please move the camera a little bit to the screen? We can see your slides, the big screen beside you. Sophie, we didn't see the slide yet.
Because the screen is normal here, so we'll try it again.
Yeah, okay. But continue.
Okay. So, and with our fast, safe, and non-toxic and effective biomedical solutions, then you might be curious about how we can do that, right? So let me share with you. Accelerator Biomed has developed a safe, gentle, deodorizing and sterilizing patented technology called RAFA particle, which is also a medical instrument. Yeah. And this kind of particle can apply to many kinds of products and applications, including making vaccine of swine flu, wound care, luxurious consuming products. So you can see here, the RAFA particles has obtained 6 countries' patented technology. Also, it has been certified by SGS 8 categories. And it has proved that the sterilization ability can be as high as 99%. As long as it is not physically erased, the sterilization ability can even reach up to 28 days. And furthermore, since we have also obtained the certificate of the Food Industry Research Institute, so compared with other market ingredients such as alcohol or bleach, RAFA particles are very mild enough to be applied to the eyes and mouth, and even it can be eaten. As long as the odor of the products caused by bacteria or any viruses, then we can effectively remove and solve the problem. Yeah. And you can see here is is our 6 national patents, and here's the clinical wound dressing formula test in the hospital in Taiwan. And furthermore, since we next, the era of the medical beauty industry is coming. So we use the gene gun to design to produce this supersonic biojet and develop a series of bullets to help people to lifting and erasing wrinkles and help people to lose fat immediately. Furthermore, we can use the new technology cooperated with Guoxi stem cells company and used this to treat degenerative arthritis without any wounds and without any surgery. So it can restore health and help people to maintain the quality of life. And I'm very glad, it's our pleasure to show you that we got the most valuable investment award issued by Alibaba Group last year. And here's our market and financial situation. And we are ready to expand our market to Europe, and we welcome a lot of any collaboration opportunity like distributors or partnership and in Europe. So please contact with me if you are interested in us. Thank you. It's my presentation.
Thank you and congratulations for your investment. Okay, Yela, Dr. Lee, and Jasmine, do you have any question? Please ask.
I see that you have a very mature solution already. You're already selling it to different markets, isn't it?
Yeah. We in Taiwan and China and Southeast Asia market.
Okay. How about Europe?
Not yet.
Are you ready for that market?
We'd love to know more on the regulation law in Europe, and we are trying to focus on this, and so we need more resources and help from you. Yeah.
Okay. So what is the first focus if you go abroad in terms of Europe? What angle do you think that is the best way to go for? Because you are addressing different markets. Huh?
Yeah. So the first one that we will focus on the long-term care of the industry, because I know if there are a lot of elderly people in Europe, and it will be a very serious problem, then the healthcare will be a very important issue. So with our raw particles, it can be used to amend the wound without any pain. Yeah, and can help the wound to recover soon with our formula. And it is patented for an international patent. Yeah. So we can help more people.
Okay, I think one of the most important things is to understand wound care is a very crowded market already, yeah, in the world. So you're focusing already to high-level companies like Johnson & Johnson as well, right?
Okay. It's one of the market, then we can use it very rapidly and to see the effect. Yeah, and secondly, then we will use our biojet gum and to use our formula to treat the degenerative arthritis, and which also is a very serious problem worldwide.
Yeah. So, but the competition is fierce, eh?
Yes.
Or do you have in your idea a combination of tools and solutions that is unique?
Yeah, thank you.
That's the question. Do you have a unique solution, do you think?
Because we haven't seen any solution like us in the medicine market, and we want to use at least two special technique to combine with it, and to be a unique and rapid solution for the clinical market.
Thank you. Yeah.
Dr. Lee, do you have any question?
Hello.
Yeah.
Hello.
Could you please ask questions?
Yeah, I have a question. And actually, Yela asked the majority questions I have already. And because the other competitors, their solution is not like yours. Your solution is very unique, but in terms of regulation, it might be not so easy. So if you focus on the wound care, market. Although the solution is unique, but uniqueness is not a competitive strength in that market. This is my opinion. Yes.
So may I ask that you mean it's not applicable is for the regulation of the equipment or just the formula of our Rafa particle?
Yes, because your solution require a chemical compound and then the device. So it will be a combination of like a drug material plus device, right? But the others, they will use only patch or the other chemical compounds without device. So the regulation level is different.
Oh, I see. Let me explain that with it. If we focus on the wound care, we can just use our Rafa particle. It's a solution and the gel, just like a patch. Yeah. Right. And our biogel is for the degenerative arthritis. So it can be used to inject our formula without any wound and without any surgery to help people to grow back the tissues without any pain. Yeah.
Sorry, I think what I was saying is actually the regulation. For you, you have a combination of a gel plus device, but you need clinical data to demonstrate your solution is superior than the others as well. So you have two layers of difficulties to approve the product in EU.
Okay.
Yes.
Okay, thank you.
Okay, time is up, and thank you for your pitch, and thank you for jury questions. So we can do the offline follow-up later, okay? And now let's move to the third picture, Pony World Technology Corporation. Sophie, please play the slides.
Good morning, gentlemen.
Can you see the slide?
Not yet.
Not yet.
Please go ahead to save the time, okay? I know you want to go home earlier. Oh,
Okay, my name is Ron Chen. I am founder of the Honeywell Technology Corporation. Today, I would like to introduce the world's most advanced PERS system, Personal Emergency Response System. Okay, we founded in 2004, and we focus on the home care, smart hospital, and the long-term care solution. And our core technology is fortification and also the indoor positioning. And we have a total solution with the cloud and the big data, and also focus on the smart care, okay, safety. And we know that four is very important and the cost of lots of national expense cost for the country. So 81% of the children, they care about their parents' safety. So we spent many years to come out the world most accuracy and also the least false alarm, device, and then combine to the total solution. We compare, we compare to the Philips, the accuracy more accuracy than the Philips for 99%. We are okay. So the technology value is we not only the PERS now, but also the fortification and also the positioning combined together to do the the real-time care solution. We got the US, we got the Japan, we got China, and also the Taiwan patents. And this slide shows that with the B2B market, but there's a fortification, emergency, and also the long stay and e-phase solution. can be seen in the real time. And this is a home solution. Okay, this is our slide, and this is home solution. We use the most advanced Bluetooth 5.0, and we got because we got the desired wall. Okay, we first on the B2B market, then we go to the home care market, B2C market. This is one of the example in Taiwan University Hospital. It's the COVID-19. This is for the patient, for the fall, and also the emergency solution. This example is for the China medical channel for the home care. They combine with the thermometer and also the other healthcare sensor together. This is for the NGO in Taiwan, also for the home care solution. We got this three examples. We not only have the three examples, but also we have others. This is the most currently we just implement. Okay, this solution combined with the voice. Okay, the voice Alexa combined with the device can be combined together to give the interactive in real-time response. This slide shows that we also work at the Hong Kong business is for the elderly apartment, merger, and also the nursing home solution. For the fundraising, we are for fundraising we use $2 million, and the usage is enhanced sales because we already have the product solution and also example in Taiwan and also Hong Kong. We want to expand to Taiwan, China, and also US, also the hopefully Europe. Okay, so we also enhance the cloud and customer service, the virtual regulation, and also the new product design. Okay, so we will show that some video for new example we did it in Taiwan. Okay, please show the video for the fall detection. It's a new example. They emulate many kind of the fall for the nursing home.
To save time, maybe you don't need to play the video now. We can go to the Q&A. Okay?
Okay.
Yeah. Sophie can share the video to us. We can put in the Facebook and our website. Okay? Here, okay. I think you have a question.
Hello? Yes. Do you have any questions?
Yes. Thank you very much for your comprehensive presentation. I really like the way you presented your product and your solution, and it's quite a mature solution already. Yeah? So I'm very pleased to see that. I'm not so pleased that you're not focusing on the EU but US. So I am trying to convince you to go to the EU as well. What if you go to the EU, what kind of market are you focusing on? Is that the nursing home high level, or the let's say the public nursing homes, or the residential homes where people have a little bit more money than others? What is the high end market or the generic market? What are you focusing on?
We have we have a solution for the nursing home. We have solution for the hospital, and we have solution for the home. So maybe I was told that Europe is very good in the. It's popular in the nursing apartment. Maybe that's a good approach. I would like to ask request your idea suggestion how to go to the market. We don't have experience yet. Sorry.
Oh, okay. So, but most of the time, it's all about pricing.
Okay.
And the market you choose is all about pricing. So if you go to the normal nursing homes, you can have probably a little bit higher price than if you go to the homes of people. Instead, you can also go to the high-end market in the residential homes, where people have a lot of money to spend on health. So those two angles, I would say, nursing homes and residential homes, that would be the best way to go for into the market, I think.
Yeah, that's good suggestion. Thank you.
But what's the price level that you're focusing on? Estimate on the price?
At first, we would like to do a product as the base, and also we would like to seek the channel or the agent partner for our nursing home, product solution. Yeah, this can be discussed in parallel because we already do this product very easy to duplicate, it's easy to implement, it's easy to install. It's very easy and it's high technology. It's a Bluetooth 5.0 is most advanced technology. We make it simple, easy to install, and also price is attractive. Yes.
But if you look at your device, which is an alarming device, and I see you have it on your neck, isn't it?
You mean price in the US?
Yeah. No, the device you are also wearing it on your neck.
Oh yeah, this one.
Yeah,
this one, yeah. This one is, we have two kind of solution. One is without with gateway. One is with the mobile. You can go out and you have GPS on the mobile. Can know your position. Okay. Yes.
This is considered to be a medical device or not?
This is not a medical device. It's not medical device. Yeah. This is not a medical device. Okay. So it's not go through the like FDA. No, it's no need for that. Okay.
Because there is a lot of regulation in Europe on personal alarming systems.
Yeah. So
that means that you have to go to certain CE regulation processes.
Yeah. We are in progress. In process now is for the CE certification. Yes.
Okay. And do you know your competitor Tunstall? Tunstall.
No, I don't know. So we know about Philips. Philips, our competitor, number one competitor.
I know it. Yeah, Philips is one of the competitors, of course, but it's not very big in Europe in terms of alarming systems. He's very big in the US, in the Lifeline. I know that. But in Europe, the biggest leader is Tunstall. So please look at it and compare yourself in your uniqueness. Compare yourself to Tunstall. It's a UK-based company, but it's a market leader in Europe.
Okay, thank you very much for your, the advice and suggestion. Thank you.
Yes. I know a lot about this market. So if you want to go further, we can organize with Valerie and follow up on this. I know this market very well.
Yeah, yes. You know, Valerie, we met each other 2018. Remember?
Yeah.
Yes?
Yes,
okay.
Yes.
Thank you for your message.
Thank you.
Yeah, and the next one is the iNavy cannot come in person, so Sean will play the video for 4 minutes. Okay, Sean, please share your video. Yes, no sound. Yeah.
Hello, ladies and gentlemen. We are a surgery navigation system provider. Today I would like to share with you study that visualization and navigation solutions for brain surgery which has been commercialized. I will have 6 topics to introduce our startup in team, product, intended use, pre-market submission, marketing, finance, and our solutions. Other than team and product introduction, I'll be presenting with 2 whys, 2 whats and 1 how focus. Why do this design and development? Unmet need and intended use. Why isn't there such design and development ever before? Marketing strategy. What, how have we done? PMN progress and our solution. What is our financial plan? First of all, as you can see the screen, the founder is Professor Seng, and the co-founders are HSU, Chen, and Cheng, who are responsible for R&D, testing, PM, HW, Op, and QA. Of course, for forming a whole team, we are seeking those who want to join us, especially the graduates of our NCU laboratory. Other than the management team, concerning the product, here I would like to show you product appearance. This is the product outline. As you can see, it's including a system card, robot, optical tracker, and its markers. App and LA view X-ray images offered by C-arm for mapping all features by markers. Now the product is in hospital, the electromagnetic compatibility and electrical safety and clinical tests are in progress. Let's see the unmet need. If surgeons don't have real-time navigation, they have to check many medical images, X-rays ahead, and they might still not get the position they want exactly, so they always need to take X-rays to check step by step in the operation. If without robot or R, they also need to lift their head to look at the LCD monitor back and forth. For brain, spine surgeons who require high precision and less radiation during surgery, the iNavi Intelligent Navigation is a system that uses an algorithm to track real-time images during the surgery. We have not only robot-assisted, the extended arm with a ring will be stopped firmly at a position of the right distance and angle. But also, we have Mr. Assisted, you'll have what you see is what you can get. For the intended use, the high-risk brain surgery, it supports the minimally invasive neurosurgery. Our QPs, quality procedures, and WIS working instructions and document platforms of FDA, TFDA, and CE marketing has been done. After verification and validation, we can apply them in order CE, FDA, TFDA, and CFDA. As you know all regulations we will meet and directives, so it's good to in EU if we get an agency there. Our product is in the V&V stage of QMS product realization. It goes smoothly and we are ready for pre-market notification. Please see the next page. We will have clinical test and pre-market submission in time. The clinical tests will be completed in the middle of 2021. Let's go to see our market strategy. We refer to the Transparency Market Research, Grand View Research, and Verified Market Research. For the global surgical navigation system market, it will have $1,082 million in 2022. Especially the annual growth rate is up to 8.5%. And for the healthcare augmented and virtual reality market, the total amount will be up to $5.1 billion by 2025 with an annual growth rate of 36.35% from 2017 to 2025. Our customers and potential ones will be the medical schools, education, training, and hospital clinical applications. Here is a table that shows a comparison of our system and other commercialized RS system. First of all, there are no commercialized augmented reality-assisted navigation system designed for brain surgery except our system. The first FDA-approved RSX Vision from Augmetic is designed for spine applications. The system from Philips is neither. In addition, our system also integrates endoscope, video, and robot-assisted guiding to provide intra-operation image source and high accuracy and stable robotic guiding in the navigation stage. Here to combine the spine surgery navigation function for comparing, so this page is only for your reference. To sum it up, the competitors are following up. Main ones are the Medtech and Augmetics. The former one is neither MR nor brain surgery support. The latter one only can support spine surgery, although has been equipped with our two products, the computer aid education and the surgery navigation system. This list shows our suppliers and supporters. You can see Zeem, the X-ray maker in the EU, and some tests are in the Cathay Hospital. This is our financial plan, $2 million needs, and will be used for CE marking clearance, clinic trial, and R&D expense. Let's go to see the next page about our solutions, the 3D visualization and robotic navigation system. Throughout our algorithms of programming, it achieves intuitive visualization and improves safety for 3D artery and spine projection. Pre-planned surgical path and increased stability in robotic navigation system reduces X-ray during operations. This system is designed for brain surgery such as brain aneurysm or pituitary adenomas treatment. In conventional surgery, due to the complexity of the brain anatomy structure, the pre-operation image including the structure of arteries and neurons cannot be mapped onto the real patients and the lack of intra-operation inspection methods. It is hard to decide the incision point and surgical path. By using computer-assisted surgical navigation technology, this surgical information can be presented in an intuitive way to help surgeons to overcome the practical issues that occurred in conventional methods. With the 3D reconstruction technique, the high-quality virtual contents such as artery structure 3D model can be obtained based on pre-operation images. By integration, inter-operation position information of the patient and surgical instruments, the spatial relationship between virtual contents, instruments, and patients can be calculated. Our team has worked on these fields for over a decade. Finally, we merge the instruments and patients in real-world virtual contents using augmented reality on head-mounting display HoloLens, which will provide an immersive surgical navigation service. For a brain aneurysm, the incision point and the surgical path avoiding hitting the artery can be decided easily by using this device. For the patents we have or in progress, this is for your reference. This is about our contact info.
Thank you, Sean, for playing the video. Due to the time limit, 3 jury could summarize your question to Valerie. I will ask this company, iNavy, to answer, and then you can put in your score, okay? Let's move to our next pitch. It's Ellen Swangbong. She has a very special Sean, could you please play the slide for Ellen?
Hier, dat is Fadi, hè? Dat is nou bezig, hè?
And the rest of the guests, could you please mute yourself? Thank you. Ellen, go ahead. You have 4 minutes.
Okay, thank you. First of all, I want to thank you for the opportunity to give my presentation here on this platform. My name is Ellen Swanborn. I'm the owner of this company, and I'm also the president of 2 patient organizations. And during my work as president, I noticed that there was very little information for children about diseases. So that's when I get the idea. I'm a drawer, a painter. I get the idea to make a card game for children to make them understand which disease they have and how they can treat it. I make one, and I make it with a medical specialist on that area, and it became a big success. So after that, my company was born, and now the medical specialists come to me and ask me if I want to make a card game for a specific disease. So that's the born of Swanborn illustrating. Next slide, please. Yeah. Today I want to talk a little bit about these medical card games. Later on, I tell you more about a special card game I make. Next slide, please. Next slide. Yeah. The cards are meant to explain the clinical picture so that children understand what disease they have, and they can understand when they play the game to which doctor they have to go and what you can do about it. Next slide. The next slide, yeah. They learn about the treatment, and very important with children and also for adults, of course, is that they are taking their treatment continuously. So that's also one of the reasons this card game is important. And also important, you see this game is about ichthyosis. It's a very rare skin disease with a lot of burden. So it's important for children how to deal with it. How can you make the quality of life of the children better? Next slide, please.
Van de Odrax, hè? Van Drakas.
Yes, so the game promotes the understanding.
Het Duitsland ook.
Somebody is talking.
Met daar bezig, met daar. Wat?
Please, can you mute your phone, please? The game promotes understanding regie, but I don't know the name. But that children understand by themselves how they can treat themselves and when they have to apply their ointment, things like that. And yes, therapy compliance, I told that before. Because of the repetition, it provides more knowledge, and the skills are also taught in a funny and playful way. I think that's very important for children. Next slide, please. Yes, in the Netherlands, I sell the games now to hospitals, to GPs, patient organizations, and also to private individuals. And it's a big success. It's getting better and better. Next slide. Yeah, because it works so well, I decided to develop a COVID-19 game. I think that's very important. What could be better if all children understand how the virus works and what they can do about it, and also how to prevent it. I think that's very important when children learn that. You see some examples of the card of the game. You see that I teach them, I learn them what the COVID virus is, what they can do, stay at home. This is not translated in English, so I translate it for you. Wear a mask. Yes, what are the risks? Many people together. The corona test, everything is in the game. There's a lot more than this, of course. So I think it's a complete game. Next slide, please. Yeah, this is where I need you. I would like some guidance on how to roll this out worldwide. I'm a very creative woman, but this is the thing I don't know. For example, printing the games in another country, for example, in Taiwan, is much more cheaper. So I can sell the cards also cheaper then, so you can reach many, many more people. And I need people to translate the games in different languages. And of course, it would be nice if there were investors who likes this idea and give me some help with it. Thank you.
Thank you, Ellen, for your good presentation. And Sri Jury, could you please ask your question? Yella?
Yeah, Ellen, thank you very much for your presentation and your card game. I have a little advantage, of course, that I can see the Dutch and I speak Dutch.
Yeah.
What I would like to emphasize is that globalization is not only on language; it's also about cultural things. How do you envision that?
Well, I think the drawings on the cards are they could be for every country. It's not cultural. How do you say? Het zit niet vast. It can be used in all countries. They're very universal.
Okay, so you think that if you want to express something, how to do something, how to let's say how to follow certain procedures in a Chinese language or in a Taiwanese culture is different than from doing this in Germany or the UK or the Netherlands.
Yes, I understand. But when you say, for instance, the distance you have to keep and the rules of the coronavirus are the same all over the world. I mean, the rules in what does the virus do and what is the best to prevent it. I think that's similar everywhere. So I think, yeah, the culture is no problem for this game.
Okay, thank you. Yeah.
I think this case, maybe my colleague, you could follow up together with Ellen, because I think maybe Ellen like to know some patient organization in Taiwan or hospitals. Yeah, this is not really a profit thing. I think this is also to do with to educate the children or the patient about their disease, right?
Yeah.
Natalie, do you have any question?
Yes. Hi, I'm Yijuan Li. My question is, in Asia, we have a great influence of Japanese manga culture here. So for this kind of medical education, the Japanese has made a lot of animation film.
Yeah.
Maybe not about COVID-19 yet, but they make some animation films to educate the children about how to fight the bacteria, how to fight virus with our immune system, or how to protect themselves from getting disease. And so when I look at your first or second slide, you also had ability to make animation as well. So my question was why you just skip animation and then do the card games? Is there any particular reason for you to do so?
Yes, there's a lot of people ask me also, why don't I make an app to play this game? I think it's very important that children play it with someone. I think children are a lot of time they're on their PCs and on their tablets and phones. I think it's a good thing that they have something in their hands. It's material in their hands, and not on an online thing. Is one of the reasons. And I think, of course, I can make an animation of this, and they look at once maybe, and that's it. And a game is something that repeats things, so it's better for a child to learn something when you repeat it. Also, they have to do something themselves to learn it. And it could be a lot of fun also. They can give presentations with it on schools. They can use it in a lot of ways. And then I'm not only speaking about the COVID game, of course, but also the other games. When children have rare diseases or something, it's difficult to talk about. And then a game like this would make it easier for them. They can explain it to other children when they play it with other children. So that's also the meaning why I don't use an app or why I don't use an animation for it.
Ellen, I think it's you answer reflect, and Dr. Lee question reflect to what Yella said about culture. I also noticed in Netherlands, children and family like to play the board game, but I think in Asia, children play on computer game or watch the animation. Maybe there's something. Michael, could you please follow up this case? Michael?
Yeah, I think that this is a education aspect that in Taiwan that we know that in COVID-19 that the government promote this common knowledge very hard, so we can read all the skills and knowledge from television. So so this may be your competitor because the government will notice this. This situation is quite important. So, but if you can establish the more comprehensive diseases knowledge, I think that would be valuable to the market. Yeah. Yeah. And also the Taiwan, we, as you say that we have quite good manufacturing capability. So not only manufacturing high tech, but also in the printing industry. So I think that will be we can assist you in this manufacturing side. Yeah. Okay, thank you.
Yeah. Also, Ellen, Michael has a very good connection to the Southeast Asia country, right? They have their network. So I hope you follow up. So thank you for all the pitches and jury effort to do the Q&A and the evaluation. And I hope the jury will finish your score and email to me. And next Monday, we will announce the winner and we will announce the prize. Okay. Michael, do you want to make a closing remark?
Can I say something as well?
Yeah, could you? Yeah, please.
Before Michael takes the floor for the closing remark, I would say congratulations, Michael, with presenting a high-level iNavy as well. So I know them a little bit more than the others, but I'm very pleased that we are connected. And I hope that this is a first-time attempt to exchange knowledge and expansion possibilities. So I would like to emphasize that we want to expand it as well in future meetings, and we bring more companies from the Netherlands as we did now. Thank you very much for your attention and your coordination here.
Yeah, this is really the beginning of the new cooperation. Michael, could you please give the closing remarks? Thank you.
Hey, so just you mentioned that this is the first time that we do this kind of video online matching. So I think it's a very good step, and also I think that will be successful. So we hope that this 4-star company will get your support and can go to the Europe market smoothly. Thank you again, and thank you, Valerie. Thank you, Tiger and Accelerator. So also thank you, the Xintai Power Bureau, so that we can get this chance. So
and
anyway,
also see each again.
Yeah, thank you. We just missed a nice cake and coffee at the garage cafe. That's the only thing we missed today. Thank you.
Bye-bye.
My colleague made the Facebook live streaming, so I think it's recorded. We will send you the film so you can share the film with more other people, okay? And thank you, and have a nice weekend. I know you are going home, and yeah, safe trip to home, and have a nice weekend with your family. And thank you for the lecture. Have a nice rest of the day. Thank you. Bye. 谢谢。